Central venous pressure describes the pressure of blood in the thoracic vena cava, near the right atrium of the heart. CVP reflects the amount of blood returning to the heart and the ability of the heart to pump the blood into the arterial system. It is a good approximation of right atrial pressure, which is a major determinant of right ventricular end diastolic volume. CVP has been, and often still is, used as a surrogate for preload, and changes in CVP in response to infusions of intravenous fluid have been used to predict volume responsiveness. However, there is increasing evidence that CVP, whether as an absolute value or in terms of changes in response to fluid, does not correlate with ventricular volume or volume responsiveness, and so should not be used to guide intravenous fluid therapy. Nevertheless, CVP monitoring is a useful tool to guide hemodynamic therapy. The cardiopulmonary baroreflex responds to an increase in CVP by decreasing total peripheral resistance while increasing HR and ventricular contractility in dogs. Measurement: normal CVP can be measured from 2 points of reference, sternum 0 a 14 kmh H2O, mid-axillary line, 8 a 15 kmh H2O. CVP can be measured by connecting the patient's central venous catheter to a special infusion set which is connected to a small diameter water column. If the water column is calibrated properly, the height of the column indicates the CVP. In most intensive care units, facilities are available to measure CVP continuously. Normal values are 5 to 10 cmH20. Factors affecting CVP: factors that increase CVP include hypervolemia, forced exhalation, tension pneumothorax, heart failure, pleural effusion, decreased cardiac output, cardiac tamponade, mechanical ventilation and the application of positive end expiratory pressure, pulmonary hypertension, pulmonary embolism. Factors that decrease CVP include hypovolemia, deep inhalation, distributive shock. See also, pulmonary capillary wedge pressure, jugular venous pressure, central venous pressure. References. External links: Venous function and central venous pressure, a physiologic story, a technical discussion of the more modern understanding of central venous pressure. This may well conflict with the sources below. Central venous pressure monitoring, cardiovascular physiology concepts, central venous pressure and pulmonary capillary wedge monitoring, cardiovascular physiology, central venous pressure at the U.S. National Library of Medicine. Medical subject headings.